I'm Dr. Sri, I'm a board certified family medicine and sports medicine doctor. In this video, I'm going to discuss how to prevent low blood sugar during exercise for individuals with type 1 diabetes as well as individuals with type 2 diabetes who are currently managing their condition with insulin injections. So individuals with type 1 diabetes are usually managing their condition with a combination of a short-acting insulin as well as a long-acting insulin. The short-acting insulin can be either insulin Lispro or insulin Aspart, and the long-acting insulin could be either insulin Glargine or insulin Detemir. In some type 1 diabetes are managing the conditions with insulin pump therapy. In type 2 diabetes, some patients manage the condition only with long-acting insulin injections like the insulin Glargine or the insulin Detemir. Some type 2 diabetes patients will take a combination of both short-acting and long-acting. So basically the short-acting, again, the Lispro, Aspart, and sometimes they might be even taking regular insulin. And the long-acting could be the insulin Glargine and the insulin Detemir. I provide a detailed explanation of how these insulin injections work in a separate video, and I'm going to include all the links in the description box below. Now let's understand why there is a risk for low blood sugar during exercise if you're currently on insulin injections. So assume I don't have diabetes. So when I exercise, my body's insulin levels drop, while the level of hormone glucagon and the stress hormone cortisol, they increase. This signals the liver to release sugar into the bloodstream, and thereby they provide energy for the exercising muscles. There are three main types of exercise. So we have a continuous moderate to vigorous intensity activity like jogging or running, or one can do interval training where one might exert maximum effort for a period of 30 seconds to 1 minute, followed by a recovery jog or walk, and they continue to repeat this cycle multiple times. Or one can do strength training, which include activities like lifting weights, doing push-ups or pull-ups. So imagine I'm running at a moderate intensity in the treadmill. My insulin levels would naturally decrease, thereby letting the liver to release glucose into my bloodstream for the exercising muscles. So basically the liver releases glucose into the bloodstream, the muscles absorb the glucose, and when the blood glucose drops, the liver releases more glucose, and thereby our blood sugar remains steady during exercise. Now let us consider high intensity exercise where I'm alternating between running and jogging in the treadmill. In this scenario, there is a lot of stress that is going on. The hormones glucagon and cortisol, they increase the blood glucose levels. So ordinarily, even when there is a decrease in insulin during exercise, there is still some amount of circulating insulin in the bloodstream, thereby preventing the excessive rise in blood sugar that is happening due to the stress hormones of glucagon and cortisol. But since there is a lot of stress going on, the body wants to make sure that the blood sugar does not drop too significantly. So this is why the body creates a state of insulin resistance where the insulin activity is a little bit suppressed. So even for those people who do not have diabetes, their blood sugars can rise up to 160 mg per deciliter during high intensity exercise. Now let us assume that the individual has diabetes and they're currently on insulin injections. Now what happens? So some individuals with type 1 diabetes, and there are some type 2 diabetes patients, they might be doing a combination of short-acting insulin and long-acting insulin. So let's go to whiteboard here. So these are the short-acting insulin. And then you have the basal insulin, which is also called as the long-acting insulin. So let us assume that I'm injecting a short-acting insulin for my breakfast here. So the short-acting insulin starts to work. It peaks around 2 hours and it completes its action around 4 hours. But let us assume that I'm going to exercise around like 10 o'clock after I take my short-acting insulin at 8 o'clock. And let us assume that I injected 6 units of insulin. So there are still 3 units of insulin. So only 50% has acted in that 6 units and is still circulating in the bloodstream at 10 o'clock. So that 3 units can act on the liver and prevent the release of sugar released from the liver into the bloodstream for the exercising muscle, and thereby increasing the risk for low blood sugar during exercise. Which is why when somebody is taking a combination of short-acting or long-acting insulin, I would recommend exercising after 3 to 4 hours after you take the short-acting insulin, or if you have planned exercise, then making sure that you adjust the insulin dose for the pre-meal. So this way you don't have the risk of having low blood sugar during exercise. So now that we have understood why low blood sugar occurs during exercise, let's discuss how to prevent it. So to properly manage our blood sugar levels during exercise, we want to make sure that the insulin levels remain low. It doesn't have to be too low. And again, how much low it needs to be depends on patient to patient. But you want to make sure that the insulin levels are slightly low, so this way the liver can keep pouring glucose in the bloodstream, and thereby we can keep the blood sugar stable. For those using the combination of short-acting and the long-acting insulin, one option would be to make sure that you're exercising 3 to 4 hours after taking the insulin injection. So this way you're pretty sure that there's no circulating insulin in your bloodstream that can cause low blood sugar during exercise. For example, one can consider exercising early in the morning or sometimes in the evening 4 to 5 hours after lunch. It's important to remember that aerobic exercise increases insulin sensitivity, whereas exercise like high intensity or strength training can lead to insulin resistance and thereby potentially causing a rise in blood sugar levels. In such cases, one may need to take extra insulin before exercising, depending on each individual response. However, let's say you plan to exercise after a meal. In that case, you want to make sure that you adjust your short-acting insulin, thereby preventing risk for low blood sugar during exercise. If you're engaging in moderate to vigorous intensity aerobic exercise, I would recommend to reduce the short-acting insulin by around 25 to 50% for a 30-minute session, 50 to 75% for a 60-minute session, and sometimes even skip insulin if the exercise is going to last for 90 minutes or more. This adjustment requires trial and error approach depending on your body's response to exercise. For strength training or high-intensity workouts, you might need to occasionally inject 1 to 2 units of insulin before working out. Usually I advise my patients not to make insulin adjustments, but then depending on the blood sugar rise, they can increase that dose by 1 to 2 units if necessary. Now let us discuss supplementing with carbohydrates before aerobic exercise to prevent low blood sugar levels. Although these are general guidelines, I recommend formulating a plan that works for you. So let's divide into 2 groups. So group 1 are the ones that have decreased insulin for the meal or they are fasting. And the group 2, they have not decreased insulin for the meal and they are engaging in unplanned exercise around 1 to 3 hours after eating. If your pre-exercise blood sugar is less than 100 mg per deciliter and you're fasting, or you have decreased insulin for your meal, then take around 10 grams of carbohydrates before exercise. A cup of milk would be perfect. However, if you did not adjust your insulin for the meal, then I would recommend 20 to 30 grams of carbohydrates. A slice of bread and jam would be ideal. If your pre-exercise blood sugar is between 100 to 150 mg per deciliter and you're fasting, or you have decreased insulin for your meal, then you can skip carbohydrates if you're comfortable. To be on the safer side, you can take 10 grams of carbohydrates. However, if you did not adjust your insulin for the meal, then I recommend taking 10 to 20 grams of carbohydrates. Again, milk or a slice of bread would be perfect. If your pre-exercise blood sugar is between 150 to 200 and you're fasting, or you have decreased insulin for your meal already, then you can skip carbohydrates if you're comfortable, or to be on the safer side, you can take 5 to 10 grams of carbohydrates. However, if you did not adjust your insulin for the meal, then I recommend 10 to 20 grams of carbohydrates. Again, a milk or a slice of bread would be perfect. If your pre-exercise blood sugar is more than 200 and less than 250 and you're fasting, or have decreased insulin for your meal, you can skip carbohydrates if comfortable. Again, if you want to be on the safer side, you can take around 5 to 10 grams of carbohydrates. However, if you did not adjust insulin for the meal, then I would recommend taking 5 to 10 grams of carbohydrates. Again, a milk would be perfect. If your blood sugar exceeds 250 mg per deciliter, and especially if you have type 1 diabetes, it's crucial to check for ketones. Positive ketones signify a risk for ketoacidosis, a severe complication in type 1 diabetes, and occasionally can happen in type 2 as well, making exercise potentially dangerous at this time. Follow your doctor's advice if ketones are present. However, let us say that your ketones are negative, and you're pretty sure that the blood sugar spike happened just recently. Maybe you could have had some fruit juice or something like that that caused your blood sugar to spike and your blood sugar is more than 250. At this time, I would recommend following the same guidelines that we talked for when your pre-exercise blood sugar is more than 200. Again, same thing, you can either skip carbohydrates if you're comfortable, or you can just take 5 to 10 grams of carbohydrates and you can go for a workout. If you're going to exercise for more than 30 minutes, I recommend carrying a carbohydrate source with you. This could be a nutritional bar or a sports drink that contains almost like 10 to 20 grams of carbohydrates, or a 15 to 20 gram dextrose gel to use after 30 minutes. It is always wise to check your blood sugar after exercise to see if the extra carbohydrate supplement was helpful or not. If, let's say, if the post-exercise blood sugar actually spiked because of the extra carbohydrate supplement that you took, then you can consider skipping for your next workout. Let us assume that you did everything correctly. And now after 20 minutes of exercise, you start to experience symptoms of shakiness, tremors, irritability, sweating. Then you're likely experiencing symptoms of hypoglycemia. I recommend pausing the video here to check for common symptoms of low blood sugar. So what should you do if you experience hypoglycemia? So I cannot emphasize this enough. Make sure, whenever you exercise, make sure that you carry a glucose tablet or a dextrose gel. So this way, if you have symptoms of hypoglycemia, you know how to act right away. I usually tell my patients to carry a glucose tablet or a glucose gel or a dextrose gel because one, you exactly know how much carbohydrates that you're going to get from this glucose tablet and the glucose gel. So this way you can be reassured, even though the symptoms can be frightening. For example, let us assume that I get hypoglycemia and I consume a 15 gram of dextrose gel. I'm pretty reassured that this is going to raise my blood sugar, and then I would check my blood sugar after like 5 to 10 minutes or so, and if my blood sugar is still low at that time, then I can take another 15 gram of dextrose gel to make sure that my blood sugar rises. Most of the time what happens when people take candy or some other form of food to correct the low blood sugar is that they usually take in more and thereby having a hyperglycemia. Basically the blood sugar rises too much, and then they have to correct the high blood sugar rise again, and thereby increasing the risk for hypoglycemia. However, if you don't have any glucose tablets handy to treat your hypoglycemia, then you can use other foods and drinks such as 1 to 2 pieces of hard or sugary candy, or 4 ounces of regular soda, or 4 ounces of juice, or 8 ounces of sports drink that contains like 10 to 15 grams of carbohydrates, or you can consume 2 to 3 crackers. It's always important to have a diabetic bracelet so that other people know how to assist you in case of emergencies. Now let us answer our next question. Is it possible to experience low blood sugar after finishing exercise? The answer is yes. So remember, exercise improves insulin sensitivity, which means that there is a risk for low blood sugar after exercise as well, especially if you have type 1 diabetes. I usually recommend my patients, especially with type 1 diabetes, to take 15 to 30 grams of carbohydrates after finishing exercise to replenish the carbohydrate stores in our body. And during this time, it's also important to make sure that you adjust your insulin for the carbohydrates that you ingest after the exercise. So after exercising, I usually recommend adjusting your insulin dosage for your next meal and sometimes additional meals if necessary. Since exercise can increase insulin sensitivity, it might be necessary to reduce the mealtime bolus insulin dose by about 25 to 50% following exercise. Also, if you exercise in the evening, there is still a risk for experiencing low blood sugar late at night. I usually recommend a bedtime snack that combines good protein, fiber, and carbohydrates, such as cottage cheese with an apple, or a small serving of oats with fruits, keeping it around 10 to 15 grams of carbohydrates, which can be helpful to avoid low blood sugar at nighttime. So make sure that you consume carbohydrates with a low glycemic index. So some of the examples might be oats, steel-cut oats would be a good example. Fruits such as apple, oranges could be a good example. Quinoa could be a good example. So if you want to know more about glycemic index and glycemic load, make sure that you check out the video that is linked in the description box below. Using a continuous glucose monitor can be extremely helpful to determine if you require a snack before bedtime. Sometimes it might be advisable to lower your basal insulin, which is basically your long-acting insulin, on days you exercise to prevent lows later in the night. So if you're on insulin injections and do not have a continuous glucose monitor, I would highly recommend to discuss with the doctor. Having a continuous glucose monitor can be very helpful in managing your blood sugar levels. Now what about the risk of low blood sugar after high intense exercise or strength training exercises? So during high intense exercise, so basically let's say in interval training, your blood sugar will rise during exercise. But after exercise, your insulin sensitivity will improve. So basically there is a state of insulin resistance during exercise, and then the insulin sensitivity will improve. It's very hard to predict when the insulin resistance will become more insulin sensitive, but usually I advise my patients to consider reducing their insulin dosage for their meals by around 25 to 50%. And again, if one is exercising late in the night, they might need a bedtime snack as well. With strength training, it is unlikely to see a significant change in the insulin sensitivity. Again, some people might be sensitive, but again, if someone is doing an exercise like CrossFit, where there's a little bit of an aerobic component as well, along with the strength training, in that case, the insulin sensitivity might improve and thereby increase the risk for low blood sugar after exercise. Again, the same advice will go into play, where you're going to cut back on your insulin dosage for your meal, around like 25 to 50%, and may need a bedtime snack if you exercise later in the day. But again, this may require a trial and error approach, so make sure that you continue to monitor your post-exercise blood sugar and make the insulin adjustments as necessary. I hope this video was helpful. If you have any questions or comments, please post in the comment box below. If you want to know more about how insulin injections work, so basically the 70-30 insulin injections, the combination of short-acting and long-acting insulin, or just long-acting insulin injections alone, you can find all the links in the description box below. and I'll see you in the next video. Until then, goodbye.